The analysis of a woman's DNA to identify whether she is at risk for the BRAC1 or BRAC2 gene form of breast or ovarian cancer started in 1996. The technology was new at the time, and the company, Myriad, patented their technological advances. However, in 2013, the U.S. Supreme Court said, not so fast. A naturally occurring DNA segment is a product of nature and not patent eligible, simply because it has been isolated. As a result, the cost of BRCA1 and BRCA2 gene testing is expected to come down from an average of $3,000 to less than $1,000 as more companies enter the field of BRCA1 and BRCA2 testing. In 2015, TQ Medicine will offer BRCA1 and BRCA2 testing as part of a FEM panel. This will help physicians better serve their patient population because samples will be now sent to Mexico City for analysis rather than the U.S. A diagnosis of BRCA1 or BRCA2 gene mutations offers very little treatment choices. Most women elect to have a bilateral prophylactic mastectomy along with an oophorectomy to remove all tissues that might promote either breast or ovarian cancer. Some women are declining surgery and following a program of persistent surveillance with twice yearly mammograms, MRIs, and transvaginal ultrasound. The research suggests that pharmacological therapies following surgery can decrease a woman's chance of recurrence. However, physicians need to evaluate a woman's detoxification genes to determine if any of the drugs used, either to block the effects of estrogen like tamoxifen or block the synthesis of estradiol from either testosterone or androstenedione, are under the control of specific cytochrome P450 genes, which can affect drug efficacy. Tamoxifen is a good example of how a SNP on CYP2D6 can alter the biotransformation of the parent drug into its biologically active molecule endoxifen. Therefore, it would be best practices to do a pharmacogenomic test panel on every woman before they are prescribed tamoxifen or any of the aromatase inhibitors. A pharmacogenomic test panel is available through TQ Medicine and Genomic Solutions Now in the United States. Check out the respective websites for more information. This slide highlights lifestyle, dietary, and pharmacological recommendations for BRCA1 and BRCA2 carriers following surgery. As you can see, they are what I call OSFA, or one size fits all. Each patient is recommended one or more of the following in hope of preventing cancer's recurrence. Unfortunately, surgery does not ensure that the patient is cancer-free, and adjunctive pharmacological therapies are recommended to decrease a woman's exposure to estrogen. Recent in vitro research has demonstrated that estrogen may rescue BRCA1 mutated cells from apoptosis and over time promote more double breaks in cellular DNA, leading to a higher risk for cancer in the breast and ovarian tissue. If you subscribe, the year 2014 is the beginning of the personalized medicine era, then you can appreciate this slide, because instead of the OSFA approach, I have listed genes evaluated as part of a wellness panel offered by TQ Medicine and Genomic Solutions Now, which can individualize recommendations about alcohol use, the type of exercise best suited for each individual, whether that be aerobic, weight training, or a combination of both, how much dietary fat, protein, and carbohydrate would be appropriate to optimize body weight or to promote weight loss, utilization of vitamin D, beta-carotene, green tea, antioxidants including coenzyme Q10, and whether an individual, because of a bitter-tasting gene, is adverse to cruciferous vegetable consumption. I would like to point out that the genes that are in red are those linked to the NRF2 pathway and may have importance in preventing BRCA1 breast and ovarian cancer or its recurrence. A pharmacogenomic panel can also evaluate genes that encode for enzymes in phase 1 detoxification, such as CYP2D6, 3A4, 2C19, 1A2, and 2CA, 2C9. If you're interested in knowing how estrogen molecules are biotransformed, then the estrogen gene test can be very useful. I'll share more information about this test in the second half of this presentation. One last bit of information before we close this section of the presentation that will probably alter the way you think about inherited diseases in the future. We've been taught that genes that pass an inherited disease from one generation to another are fixed. However, research recently published may turn that notion on its head. Women heterozygous for the BRCA1 gene were given 300 milligrams daily of a nutritional supplement called Bioresponse DIM. DIM stands for diindolylmethane, and lecithin is used to improve its absorption. After 4 to 6 weeks, there was a 34% increase in BRCA1 messenger RNA expression. Why is this so important? First, this is the first time that a study has demonstrated an increase in BRCA1 messenger RNA expression using a dietary supplement in vivo. Second, it may give women with a BRCA1 mutation an adjunctive therapy following surgery to prevent the recurrence of this inherited form of breast cancer. We have known for quite some time that DIM can boost protein expression associated with the BRCA1 and BRCA2 genes in vitro, and through its effect on NRF2, protect against reactive oxygen species. Now we may be on the verge of finding specific nutrigenomic strategies to overcome the effects of genes considered fixed and that pass inherited diseases from one generation to another. Here are some prophylactic recommendations for BRCA1, BRCA2 breast cancer patients following surgery. These can be broken down into testing, and here again I'm recommending the estrogen gene test. For those that are interested in ordering this test, you can do so through TQ Medicine. Also, it would be important to do a salivary hormone level test and to follow up to see whether any nutrigenomic interventions need to be tweaked. I typically recommend the urinary estrogen metabolite test. Given the recent research associated with Bioresponse DIM, I would be certainly recommending this dietary supplement, particularly for women that are heterozygous for BRCA1 and BRCA2, and of course to boost antioxidants and anti-inflammatories in that woman's diet. This completes the first section of Dr. Veltmann's presentation to a group of physicians in Guadalajara, Mexico on the 28th of August. Thank you for your attention, and I hope you'll join us for the second half of this presentation.